Good morning, everyone. I'd like to thank Alice Kitchen and the League of Women Voters for inviting me to speak with you all today. As they mentioned, my name is Bridget Hughes and I live in Clay County, Missouri. I'm a McDonald's worker and a leader in Stand Up KC and the Fight for 15 in a Union, as well as a leader in the Fannie Lou Hamer's Women's Committee. I'm a working mother with 3 beautiful children, Trayvon, Rayana, and Desmond. As you know, 2/3 of workers in the fast food industry are women. 95% of home healthcare workers and childcare workers are also women. And it's no accident that these workers in these industries are overworked, underpaid, and underappreciated. But it's not just our pay. Like many mothers who are living in poverty, I have had a high-risk pregnancy with all 3 of my children. When I had my middle child, Desmond, I was working at Walmart. And when I was 7 months pregnant, I passed out at work while washing dishes in the deli. When I woke up, I was in the ambulance with paramedics hovering over me. I have diabetes and asthma, and the doctor told me I was iron deficient. I started having contractions and I nearly had my son early. The doctor told me that I was supposed to be on bed rest for a month. And while Walmart accepted my doctor's note at first, I was then, when I returned to work a month later, was told that since I was going on maternity leave in a few weeks, that I was no longer needed. And they let me go. When I had my 3rd child, Rayana, I was working at Domino's and they threatened my job and forced me to return to work 2 weeks after delivering my daughter. I went back to work because I was broke and scared of losing my job with a newborn baby and 2 other children to care for. A few weeks after returning to work, I had medical complications and I overstrained my body because I did not heal properly. And I went to the hospital and was ordered to be on bed rest for a week. When it was time for me to return back to work, still at less than 6 weeks from delivering my daughter, I was told that I had been replaced. As a result of that, we fell behind on our rent and got evicted. And even more recently, during the coronavirus pandemic, I've had to quarantine 4 different times due to exposure of the virus. One of those times including my daughter testing positive for COVID. Luckily, my daughter was okay and I tested negative all 4 of those times. But those 14-day quarantines meant that I have missed 8 weeks of work that were all unpaid. Fast food workers are almost never given any kind of paid sick days, despite the fact that we are the ones making your food. All of that unpaid time off would have left me and my family in the streets had we not gotten our stimulus checks. As a working mom, I can hardly tell you how many times I've had to go to work sick just to make sure that I would have enough money to pay the rent and keep the lights on. And there are more times than I care to count where I've had to choose between taking care of one of my children while they are sick or going to work because we couldn't afford to lose the money. I should not have to choose between my duties as a mother and my ability to provide. Every worker deserves paid sick days. That should be a basic human right. And it would bring all of us closer to having jobs where we don't have to sacrifice our dignity or our health in order to survive. Paid sick days would also help our coworkers and our communities stay safe. One of the most important lessons of the coronavirus pandemic is that your health and my health are tied together. In the labor movement, we have a saying that an injury to one is an injury to all. And when it comes to sickness, this is literally true. Because when we go to work sick, we are passing that on to our coworkers and our customers who are then taking that back to their families. I'd like to conclude today by telling you all something that I have never spoke about publicly. I'm sorry, I'm gonna get emotional, guys, bear with me. In fact, I've only shared this with my husband and some of my closest friends and family. Sorry. 3 years ago, I found out that I have cervical cancer. I went in for my annual checkup and I got my pap smear and found out that I have abnormal cells. I went in for a biopsy a week later and found out that I had cysts on my ovaries. I wasn't surprised about the cysts because I already knew that I had polycystic ovarian disease. Oh, sorry, guys. But I also found out that some of my cells came back as being cancerous. So I went back in for an MRI, which showed that the cancer had already spread to my cervix. The doctor told me that I would need to have my entire cervix removed, and if that didn't work, I would need to do chemotherapy. I don't have health care, and I can't afford to pay out of pocket for the surgery. And because I'm already $20,000 in debt for medical bills from when I had my daughter and because of my diabetes, also, I cannot afford to miss the 1 to 2 weeks of work that the doctor told me it would take for me to heal from the procedure. And I'm afraid of what would happen if I had to get chemo and wasn't able to work at all. For the past few years, I have lived in denial and in a combination of fear, dread, and anger at the fact that I don't know what to do. I'm concluding by telling you all this because I want to show you the reality of poverty wages, lack of health care, lack of benefits like paid leave, and how it leaves workers and families like mine living on the edge. Winning things like paid sick days and paid maternity leave are crucial steps in the struggle for economic justice and racial and gender equality. The economy is supposed to be a system of production that allows us to produce the things we need to survive and thrive as human beings. But for millions of workers like me, it feels like we are sacrificing our very lives and our health so that other people can reap enormous profits from our work while we struggle just to survive. My husband and I both get up every day and go to work. Neither of us have health care despite the fact that we both work for multi-billion-dollar corporations. I'm diabetic, but I have not had insulin for over a year because I cannot afford it. We don't get paid sick days, paid vacation, or retirement. Something is fundamentally broken in our society, and that's why I began fighting for $15 minimum wage and benefits like health care and paid sick days. And more importantly, for a union so that my coworkers and I can have a voice on the job and a say-so in our lives. I thank you all for taking the time to hear my story today. And I hope that you will join me and workers across the country in the fight for paid sick days and paid leave, for fundamental changes that we need so that we can have a government and an economy that works for all of us. Thank you.
Thank you so much, Bridget. I can't express enough how much it means that you would open up in that way to us. And I know that many people in their own lives or in their families' lives know stories like yours, and but for the people who don't, hearing directly from you means a lot. Thank you. All right, feel a little silly going back to PowerPoint slides, but that's what we're gonna do. And let me share my screen again. Yeah, there's a lot of thank yous coming in the chat, so I'm going to give just a moment for those. All right.